to learn about the basic terms which are used in the gross anatomy and are very much important if you want to study the upcoming modules anatomy easily. So let's just start it. First, we are going to learn some terms in relation to the trunk, neck, and face. So here in this picture, you can see the 2-point of view of your body. This is basically the anterior view or the ventral view. Anterior or ventral view. Anything when you're seeing it from the front, you're basically seeing the anterior or the ventral view of that thing. And if you're seeing something from the back, so you're looking at the dorsal or the posterior view of that thing. Okay, so that's the difference between the anterior and the ventral, anterior or the ventral, and the dorsal and the posterior. So now see it from the trunk, neck, and face point of view. This is your face. You can see the eyes of a person, you can see the nose of a person, you can see the lips. So basically you are viewing it from the front. So that's called as the anterior or the ventral view of your face. Same goes here with your neck. You are seeing it from the front, so you are viewing the anterior or the ventral view of that thing, means the neck. This is your trunk and this is your trunk and you are viewing it from the front, so that's called as the anterior, the ventral view of your trunk. Now here you can see the back of your head and the face, so that's the dorsal or the posterior view of your face. This is the dorsal or the posterior view of your neck, and this is the dorsal or the posterior view of your trunk. Okay, so that was all about the anterior, ventral, and the dorsal and the posterior. Now the next thing is the medial and the lateral. Anything which is close to the median plane is called as medially placed thing, and anything which is away from the median plane is called as laterally placed. Let me just draw a midline for it. I guess this was the straight one. Yes. Okay. So that is your midline, which is basically median plane dividing the body into the right and the left half. So if anything is closer to it, for example, this part of your trunk is more close to the midline as compared to this. So you can say that this part is more medially than this part, or not more. You can say that this part is medially placed, and this one is lateral, and this part is medial. Anything that is close to the midline is medial, and anything which is away from the midline is the lateral part. If you want to see it, you can see it from your limbs as well. Your hand, okay, if you take your hand away, you are doing the abduction, and if you bring it close, that is called as adduction. But if you see it here in your hands, not from the, you will see it from the front. Okay, so this is your thumb, which is here, and this is your little finger, means the little finger, the pinky finger, some people call it. So that is your little finger. So you can see that your little finger is more close to this line as compared to your thumb. So your thumb will be laterally and your little finger will be medially placed in your hand when you are in an anatomical position. Okay, also I will tell it in the upper limb part. So that was about the lateral and the medial part. Anything which is close to the median plane is medial, and anything which is away from the medial plane is the lateral. Proximal, cranial, and the superior is basically which is close to your head. Let me just rub all these things. Okay. So now the cranial is also called as the superior or the proximal. Okay, so anything that is close to your head, this is your head, so anything that is close to it will be called as the cranial, superior, or proximal. So let me just tell. Here you can say that this part of your joint is of the muscle. Okay. So usually we can say that the origin is basically the proximal and the insertion in the muscle is distally, but that sometimes are interchangeable, so you can't call it that thing. So anything which is here, placed here, that is close to your head, is called as the cranial, superior, or the proximal. Or anything that is placed here as compared to the this part will be will be distal, caudal, or the inferior. Okay, so that will be called as the distal, inferior, or the caudal part. Okay, so that's basically in an easy words you can call it. This is basically the stick. That's not a stick at all. Okay, so this part is above this part. Okay, so that will be your cranial part of that stick. That is your superior part of the stick. That is your proximal part of the stick. And this part is basically below this, like start A, and this part is the B. So B is basically below the A, so you can call it the caudal part, or the distal part, or the inferior part. Now in your body you can say that your eyes are cranial to your nose. Is it correct? Yes. Your nose is cranial to your lips. I think I have hide the entire face. So yes, your eyes are cranial to your nose because it's more closer to the head, so it's cranial, superior, and proximal to your nose. Your nose is distal, your nose is inferior, or your nose is caudal to the eyes because it is away from the head as compared to the eyes. So you always need a reference point when you are comparing two things. So here our reference point is the head, and the comparison is between your eyes and your nose. Okay, now same here, you can call that your face is cranial to your neck, your neck is cranial to your trunk. ठीक है, तो हर तरीके से इसको आप बोल सकते हो. Every part is somehow related to other part when you have a reference point. Now caudal is basically below or close to your tail. In the humans, the tail is no longer being found. It's just some remnant of it as your last vertebrae. So we basically considered it also in relation to your head, that is away, anything away from the head is caudal, distal, or inferior. So that was about the cranial, superior, proximal, and the distal, caudal, and inferior parts. Now superficial and deep. Remember one thing, superior and superficial are totally different things. Superior is basically closer to the head, but superficial and deep are basically inside the body. You are seeing anything which is closer to the surface of your skin, the surface of the body, that's called as the superficial, and anything which is away from the skin, that is surface of the body, that is called as the deep, like your veins and the arteries. When you see the blue lines in your hands, so that's your veins. So these are basically more closer to your surface of your body. So the veins are superficially placed, whereas you can't see your arteries that much, not clearly. So that's basically they are placed inside, means more deeper to the veins in your body. So it's not that much clearly visible when you are viewing from the surface. Okay, so your veins are superficial, and your arteries are deep. Superficial is basically close to the surface of the body, and deep is basically away from the body, away from the surface of body, Okay, so that was about your deep and superficial. Now ipsilateral and contralaterals are two things, but they are very much easy. Ipsi means on the same side. If you're talking about your, let's just first remove all these things. Okay, now this this is basically your right side, and this is your left side. So if you're talking any part of the body that both, or if you're talking about two parts of the body and both of these parts belong to the right side, so that's called as an ipsilateral. Or both of the parts belong to the left side, so that's called as an ipsilateral parts. But if you're talking about two parts, one belongs to the right side, another belongs to the left side, so you are talking about the two contralateral parts of the body. For example, you are talking about your left hand, okay, left upper limb and the left lower limb, so that will be the ipsilateral parts. If you are talking about your right upper limb and the right lower limb, so that's called as the right ipsilateral parts, okay. But if you're talking about your right upper limb and your left lower limb, so that's called as the contralateral parts, okay. So the parts of the body that are found on the opposite sides are called as the contralateral parts, and the parts of the body which are found on the same sides are called as an ipsilateral parts. Ipsilateral on the same side, contralateral on the opposite sides. Okay, so that was about this. Now the last thing, in relation to, not in relation to your head, neck and the face, but it's a general thing. Let me just draw a thing. You must have read about the amoeba in your first year. I think I have drawn it. And okay, so anything that is basically going inward, that is called as an invagination. In means inside, okay. So basically it's a projection inside. That basically invaginate, you must have read about the amoeba, that it's have a pseudopodia that surrounds the food particle, and then it make a food cup, then it turns into a food vacuole, then the food vacuole is projected inside the amoeba, that is called as an invagination. So basically the projection inside is called as the invagination, and if you're having the projection outside is called as an evagination, and projection outside or outward, you can also call it, is called as an evagination. And the best example according to me is the birds, the birding you see in the fungi are best example of it. So you can call it the birding and fungi, sorry, not fungi, in the yeast. The yeast are also parts of them. Birding in yeast are the example of the evagination. So anything that is projecting outward is called as an evagination. Anything that is projecting inward is called as an invagination. Okay, so that was about the terminologies in relation to your trunk, neck and the face. Now we're going to do the upper limb. So upper limb, ventral and the anterior view, anything you are viewing from the front. So that's the ventral, the anterior view of your upper limb. Same goes here, anything you are viewing from the back. So that's the dorsal or the posterior view of your upper limb. Dorsal or the posterior view of the upper limb. Okay, and now we have the medial border and the lateral border. So in this will be your medial border because it's lying closer to your midline of the body. So that is basically the medial border, and anything that is away from the medial border is the median plane is your lateral border. So yes, that was about the medial border and the lateral border. Now we are having here the proximal and the distal. Proximal is basically closer to the root of the limb, and distal is basically away. So for example, this is your arm. So the starting point or anything which is closer to the root of your arm is the proximal, okay, and anything that is away from your root is basically distal. What's basically the root of the limb is? Let me tell you, root of the limb is the attachment of the limb to the trunk. Root of limb is attachment of the limb to the trunk. Okay, so if you see here, this is your shoulder joint, and the shoulder joint is basically the proximal to the elbow joint, which is basically away from the root of the limb, because here at the shoulder joint your limb is getting attached to your body, or the trunk. Now we are having the last, that is the not the last, that's palmar. Palmar is the front view of your palm. Front view of your palm is your palmar aspect of palm is your palmar side. And if you're viewing your hand, your hand from the back side, that is called your dorsum of your hand. Okay, now we are having the flexors and the extensors. So this is basically the flexor of your arm. This is the flexor compartment of your forearm. This is the flexor compartment of your hand. So the flexors are basically placed. Flexors are ventral or in the front aspect. Flexors are ventrally placed. Flexors basically are the muscles that are responsible to decrease the angle between the two bones. So the muscles which are present at the anterior aspect of your forearm are the upper limb are called as the flexors. Okay, so the flexors are ventrally placed, whereas the extensors are dorsally placed. Extensors are dorsally or posteriorly placed. Okay, so you can see your tricep is basically the extensor which is present here, whereas your bicep is basically the flexor which is present here, along with the other muscles, the brachialis, the coracobrachialis. So that basically are present here and the anterior aspect of your arm. So the flexor compartment lies anteriorly, whereas the extensor compartment lies dorsally. So that was about your upper limb. Now we are having the terms that are used in relation to your lower limb. So the first is basically the anterior and the posterior. You are viewing the front aspect of your lower limb, so that's the anterior view, or the ventral view. You are here, this is the back aspect of your lower limb, so that's the posterior, or the dorsal view of your lower limb. Now the medial border and the lateral border. So let me again draw that line. Okay, so here, yes, in the foot, your thumb is basically close to your midline, whereas your little toe is away from your midline. So your little toe here is laterally placed, whereas in the thumb is basically more medially placed. And this is due to the embryological folding. When your limb is developing, so there is the folding, that is 90-degree rotation, or this 90-degree folding, as well as the rotation also. Your upper limb gets rotated outward, whereas your lower limb gets rotated inward, which brings your big toe of your foot medially and your small toe laterally, whereas in the upper limb this thing is reversed. There, when your arm gets rotated outward, your little finger or the ring finger gets placed medially, whereas your thumb gets placed laterally. So that's due to the embryological folding. Now we are having the flexor and the extensors. Here, due to the folding as well, the flexor compartment lies posteriorly, whereas the extensor compartment lies anteriorly. Here the compartments are different, the medial and the lateral position of the fingers are also different. Okay, so the compartment you're usually seen here is the extensor compartment, and here the compartment which is present dorsally is the flexor compartment of your lower limb. So I hope till here everything is clear. Now we're gonna deal about the embryological, yes, one more thing, the proximal and the distal part. So here your lower limb is getting attached to your trunk, so that is basically the root, and your shoulder joint, not shoulder joint, the hip joint is basically the root point. So if you can see here, this point is the proximal part, and this knee joint is distal as compared to the hip joint. Now as we can see here regarding the ankle joint, so your knee joint is basically proximal and your ankle joint is distal. So we call the proximal and the distal with respect to the root of the limb, and the root of the limb is basically where your limb is getting attached to the trunk. Now the terms which are basically used in the embryology and comparative anatomy are basically certain terms. Ventral is towards the belly, the anterior one, and dorsal is basically the opposite of it, that is away from the belly or towards the back, like the posterior one. Okay, the cranial or here we have done the cranial, the superior and the proximal. So you can add one more thing here, that is the rostral. The rostral is also the same as the cranial, the superior and the proximal, but it is more usually used in relation to your brain and the head. So that's the same thing. And the caudal is basically the tail part that we have already learned, that is away from the head. That's the caudal, the inferior or the distal part. So let me just give you a short summary of everything that we have read here in relation to the terms. The trunk we are talking about whenever we are talking about the interior aspect of something. So front view, that's called as an anterior, that's called as the ventral view. And when we are talking about the back view of something, that's called as the posterior or the dorsal view. Same goes here. Now just let me summarize this part first. Now when we are talking about anything which is being close to this midline is your medial part, and anything which is away from this midline is the lateral part. So here in this case, your little finger is medial and your big toe is lateral. Now that is cranial, cranial, superior and the proximal. Anything which is close to your head is cranially placed, that is superiorly placed, and that is proximally placed. And anything which is away from your head or more close to your coccyx bone, that is your tail, that's called as a caudal part, that's called as a distal part, or that's called as an inferior part. You can also use the term the rostral when you're talking about the superior part, and you can also use the term the caudal when you're talking about the inferior part. Okay, superficial and the anything which is close to the surface of the body, that is your vein, are basically superficially placed, and anything which is away from the surface of the body, that is the arteries, that's called as a deep structures. Okay, now we have last thing about this is contralateral parts are basically the parts which are present on the opposite sides of the body, that is your right upper limb and your left lower limb. You can say these are the contralateral parts, and the ipsilateral parts are basically the parts of your body that are present on the same side when you're talking about the right upper limb and the right lower limb. So these are called as the ipsilateral parts. Invagination is basically projection inward or inside. This is basically getting projected inside, and evagination is basically projection outside, and you usually see it in the yeast, whereas invagination is seen in the amoebas when they are taking up the food particles in the form of the food vacuole. Now in the upper limb we see the ventral view, the anterior view, that's called as the front view of that thing, and when you're looking from back, that's called as a dorsal or the posterior view of the upper limb. The cranial, superior and the proximal. You usually use the word proximal with the upper limb and the lower limb, not the cranial and the superior one. So the proximal is basically anything which is close to the root of the limb. And what's the root of the limb? Root of the limb is basically the attachment point of the limb to the trunk. So that's the shoulder joint. Anything which is close to this point will be proximal, and anything which is away from this point will be distal. Same goes in case of the lower limb as well. The palmar is basically the front view of your hand, and the dorsum is basically the back view of your hand. This is the dorsum of your hand. Now the flexors are basically here in this case in your upper limb, that will be the ventral part, or the ventral compartment of the muscles are basically the flexors, and the dorsal compartment muscles are the extensors muscle, like the triceps, whereas the medial border is basically close to the midline, and that's your little finger part, and the lateral border is basically away from the midline, this one. So that is your thumb. Whereas now in the lower limb, this is basically the anterior view, this is basically the dorsal view. You are viewing it from the back. This is basically the root of the limb. So anything which is close to this point will be the proximal part, and anything which is away from this part will be the distal part. This is the midline. So anything that is close to this part will be medially placed. So that is your big toe, that is basically more medial as compared to your little toe that is more laterally placed. Here in your lower limb, the anterior compartment is basically your extensor compartment, and your posterior compartment or the dorsal compartment is your flexor compartment. So that's the difference between the upper limb and the lower limb. That is, your thumb, in this case the big toe, is basically medially, whereas in your hand the toe is laterally. The thumb is laterally. Same, the little toe in your foot is laterally placed, whereas your little finger in your hand is medially placed. Same in case of the muscles. The flexor compartment muscles in case of the upper limb lies anteriorly, and the extensor compartment muscle lies posteriorly, whereas the opposite of it is in the case of the lower limb. That is, the extensor compartment muscle lies anteriorly, whereas the flexor compartment muscles lies posteriorly or dorsally. So that was all about the terminologies that are used in the gross anatomy, and I hope that everything is clear. If you are having any confusion or the query, you can drop it in the comment section. I will try to answer it. Thanks for watching. Take care.